the reproductive system. First, we will discuss the female reproductive system. Then we will discuss the male reproductive system. Okay. So, so in the beginning, it's a common. So we have human chromosome. Okay. So there are 23 pairs. Okay. There are 23 pairs of chromosome. Okay. So there are two types of chromosome, XX or XY. Yeah. No, there are two chromosome X and Y, but the combination can be XX or XY. It cannot be YY. So if it's a XX, it's always the female gender, and if it's XY, it's a male. Okay. So these are the chromosomal disorders: Pride-Duchette syndrome, Down syndrome, Plateau syndrome. Okay. First, we will discuss the female genital system and pregnancy. Okay. So in female genital system, if you see that there is ovary, so one each on both side. Okay. So are you able to see the ovary?
Yeah, sir.
Ovary. Then from ovary, the word root for the ovary is ufero. Yeah. Ufero. Yeah. Ufero. Then we have fallopian tube connected with the ovary. Fallopian. There are two fallopian tube. So the word root for fallopian tube is salpingo. Yeah. Salpingo. Yeah. Okay. Then we have uterus. Okay. So uterus is histro. Histro means uterus. The word root for his uterus is histro. Then we have cervix. Okay. Then we have vagina. So the vagina, we have two word root. One is vagino and one is colpo. Okay. Then we have labia minora, labia majora. Okay. So in heart, we have three layers. Which are the heart layer?
Heart layer.
Hmm.
Heart.
Epicardium, myocardium, and endocardium. Okay. Similarly, we have three layer in uterus. That is perimetrium, which is outer layer. Then myometrium, which is middle layer, and endometrium is the inner layer. Okay. Then we have external genitalia. Okay. So there is an area between anus and rectum. So not anus, anus and vagina, which called as perineum. Yeah. Then we have labia majora and labia minora, inner lip and outer lips. Then we have clitorius. Okay. Okay. So let me give you the more detail about this. So these ovaries produce the eggs.
Eggs.
Yeah. So there are two organ gamete. So in female, it's ovary, which produce egg, and in male, it's testes, which produce sperm.
Yes.
So when the sperm and egg fertilize, then there is a creation of fetus. First gestation sac, then it's a become embryo, then fetus, then child. Okay. So the eggs travel through the fallopian tube and come into the uterus. And normally in uterus, the fertilization take place. Okay. Then we have breast. So in breast, you need to remember that the word root for the breast is mammo.
Mammo.
Yeah. Either mammo or the masto. Okay. Then there is a black area, है ना, which known as areola. There is a nipple, and surrounding the nipple there is a black area, which called as areola. Okay. Then there are milk duct that's called lactiferous duct. Yeah. Then we have menstrual cycles. So when the menstrual cycle start, it known as menarche. Yeah, menarche or puberty. When menstrual cycle start, we it's known as menarche. And when menstrual cycle stop, say menopause. Yeah. Menarche is the starting of the menstrual cycle, and menopause the stop of the end of the menstrual cycle. And every month the female patient get menstrual cycle, है ना? That's called menorrhea. So menorrhea is the normal blood flow, which female every year for 3 to 5 days. Okay. Then we have pregnancy. So the egg has been fertilized, then they travel. So these are the days mentioned, but you do not require to go in that deep. Okay. Then the stages of the first stage which begun in for the human body is the heart. Okay. So whenever patient is pregnant, the gynecologist always first check whether there is a heartbeat or not. Yes. If there is a heartbeat, then only the pregnancy can be continued. If there is no heartbeat, pregnancy cannot be continued. Then we have placenta. Okay. So the placenta is attached from the uterus. Okay. And through the placenta, there is a umbilical cord which connected to the baby. Yes. So baby get nutrition, food, everything through this umbilical cord and placenta. Yes. Okay. It's a very important. There are 3 trimesters in pregnancy. First is first trimester, 0 days to less than 14 weeks. Second trimester is 14 weeks but less than 28 weeks. And the third trimester, 28 weeks till delivery. Yes. And every ICD selection will be based on these trimester only. Then we have disease of female reproductive system. Okay, now again recap. Yes. So as I told you that only 3 systems are large. They have multiple organs. Okay, cardio, gastro, and musculo. Other are very small. Yes. So what organ you identify in female reproductive system? There are ovaries. Then we have fallopian tube. Then we have uterus, cervix, vagina, perineum. Then we have 3 layers of uterus, which are perimetrium, myometrium, and endometrium. Then we have clitoris. That's okay. Then we have 3 trimester. First trimester is 0 to 14 weeks, less than 14 weeks. Then 14 weeks to less than 28 weeks. And then 28 weeks till delivery, third trimester. Okay. When the menstrual cycle start, we say menarche. And when menstrual cycle stop, we say menopause. And normal blood flow is menorrhea. So what is menorrhea? Normal blood flow. But if there is a difficulty, then what we will say? Dysmenorrhea. Yes. Okay. So here is menstrual and hormonal disorder. So first is dysmenorrhea. Yes. Dysmenorrhea means painful menstruation. Yes. Okay. Amenorrhea is absence. If somebody do not have menstruation, then it's a amenorrhea. And PMS we have premenstrual. Yeah. Okay. Then we have endometriosis. Okay. So endometriosis will happen where? In the inner layer of the uterus. Then we have uterine bleeding. Some people have uterine bleeding, some have vaginal bleeding. Okay, so two are the different. Then we have oligomenorrhea, yeah, polymenorrhea, and metrorrhagia, bleeding between the periods. Okay. Then we have STDs, sexually transmitted disease. We have PID, pelvic inflammatory disease, candidiasis, chlamydia, genital herpes, genital bud, gonorrhea, okay, and HIV, syphilis, trichomonas, HIV. So these are the sexually transmitted disease. Gonorrhea, syphilis, trichomonias, these are the very common. Then we have benign lesion. You will found this uterine fibroid in many reports. These are the common. In this, the small tumors develop in the uterus. Okay. So what we call uterine fibroid. Then cancer can be happen every place, and it can be in the breast, it can be in the cervix, it can be in the uterus, everywhere cancer can be here. So the most common cancer in the breast, BRCA1 and BRCA2. Malignant lesion, carcinoma of the cervix, which I told you, anywhere it can be happen. Pregnancy. Okay. So some disease are in pregnancy, happen. First is placenta previa. So normally what happen that a placenta is on the edge of the opening of the vagina, then we call placenta previa. Because if that condition happen, then a patient can underwent the abortion. So in placenta previa cases, the gynecologist always advise to take complete bed rest. Okay, I will show you what is placenta previa. Okay, so this is normal placenta, the first image, and in the second placenta previa, there is a vaginal opening and there is a placenta. So in that case, the physician advised take complete bed rest. Okay. Then abortion very common in if somebody do not want to continue with the baby, then go for the abortion. है ना? There are spontaneous abortion which can the miscarriage. So patient do not want abortion, but it's happened. Okay. Then incomplete abortion. Then there are two type fetal demise. Okay, fetal death inside the uterus. Okay, Then we have this vaginal delivery, okay,
Yes.
and cesarean delivery. है ना? So these are the common procedure in, but these are not procedure. We are discussing the disease. Okay. So any query?
No, sir.
Any query in female reproductive system? Okay. Then we have male reproductive system. So what organ we have male? We have testes.
Yes.
So what testes do? They produce the sperm.
Yes.
And the outer covering of the testes is scrotum, which maintain the temperature.
Yes.
Okay. Then these sperm travel to through the Bas difference. They travel to the Bas difference. Okay. Then there is a prostate gland. So in male patient, the most common cancer is in the prostate gland. That's why physician advise that if somebody is age 50 or 55, they need to undergo the PSA test, prostate specific antigen, to check that whether is there any cancer cell or not. Okay. So the in case of the cancer, early detection is always preferred. Okay. So what happen? Most of the time, patient do not recognize and do not understand the early testing, and once it's a third or fourth stage is there, then only they realize that they have the cancer. So now, if you can say that most of the celebrities always get early detection
Yes.
because they always go for the routine checkup. But normal human being, they always realize when the condition gets severe. Okay. So there is a rule. What rule? Suppose so what we are discussing.
Essential organs
Mhm.
for that male.
Okay, so I'm not sure where I what I have discussed. Okay, so testes produce the. Okay, so I am just saying that if we are going as a human being for, yeah, recording is there. So if we are going for test and our test report are normal, so one we what we say, it's a wastage of money. So rather than you are happy that you do not have anything, you always say that, okay, I have wasted my money because everything is normal. Okay. So it's not, it's always good that everything should be normal. Yes. So the PSA normally advisable when the patient cross the 50-55 year, है ना? Yes. Then to detect the breast cancer. Okay. So there are so many tumor markers which physician advise, but normally we do not care about that, and we always stick with what we learn on. Okay. So testes, what testes produce? Sperm. Okay. Then we have Bose difference. I told you that the sperm travel through the Bose difference. Okay. Yes. Then there is a epididymitis. Okay. What is epididymitis? So the testes produce the sperm. Testes produce the sperm, but its storage in epididymis. Yeah. Then we have, okay, bulbourethral gland. So bulbourethral gland or Cowper's gland are in male, not female. Yes. So sometimes they ask that where is bulbourethral gland? So it's in male. So what organ are in male genital system? Bulbar. Mhm. What we learned till now in male reproductive system. Which organs are there? Okay, what organ we learn in female reproductive system? What organ we learn in female reproductive system?
But female reproductive system, we learn eggs were forming and
Which organ produce the eggs? Ovary.
ovaries.
We have in female reproductive system, we have ovary, we have fallopian tube, we have uterus, we have cervix, vagina, uterus free lining, perimetrium, endometrium, myometrium, we have perineum, we have clitorius, we have labia majora, labia minora. So you need to learn in this way, okay? But in male female system, we have testes, we have scrotum, epididymitis, vas deferens, and the gland penis also. Yes. Okay. Then we have disorder of the male genital system. Cryptorchidism. Yeah. So the if testes are hidden in the abdominal cavities, testes are hidden in the abdominal cavity, then we say cryptorchidism. Yeah, orchio means testes, or we say undescended testes. Okay. Orchitis is inflammation of the testes, epididymitis, inflammation of the epididymis, hydrocele, collection of fluid in tunica vaginalis. Yes. Okay. Then we have epispadias, hypospadias. Okay. But the two common diagnoses which you will found, one is velinitis, inflammation of the gland penis, and another is phimosis. So there are two common diagnoses you will found in the male reproductive system, Valenitis and phimosis. For that, normally physician advise the circumcision. Okay. In prostate, you will found the most common diagnosis is BPH, benign prostate hypertrophy. Then prostate cancer, of course, is the most common diagnosis in the male reproductive system. Okay. Then we have common procedure of male and female reproductive system. So in female, it's mammography. So mammography is the screening of the breast, female breast. Okay. Amniocentesis. So when there is a pregnancy is going on, so there is a water bag is there that we call amniotic sac. So if the fluid is too much, so baby is not able to float in that. Okay. So what physician do? They do the amniocentesis and remove some fluid. Okay. Then tubectomy. So if they cut the fallopian tube, then it will be tubectomy. Then we have colpotomy. Colpo is vagina. Incision in the vagina, colpotomy. Then dilatation and curettage. So dilatation and curettage can be in pregnancy and other than pregnancy also. So if the patient have uterine fibroid, the physician normally do the D&C, dilatation and curettage, to remove these fibroids. And if physician do not want to continue with the baby, then again physician do the dilatation and curettage to complete the abortion process. Okay. Then we have colpopecia, fixation of vagina. If there is a cancer in uterus, then physician remove the uterus. That is hysterectomy. Hysterectomy. Okay. Then we have mammoplasty. Okay. So what is mammoplasty? It's a surgical repair of breast. Okay. Then in male, if patient has prostate cancer, it can be removed. TURP, transurethral resection of the prostate. Or if his testes is hidden in the abdominal cavity, then there is a orchiopexy. Then circumcision is there. Circumcision, prostatectomy. These are the common procedure in the male reproductive system. Any query you have from the urinary system we have discussed today? We have discussed the male reproductive system and we have discussed the female reproductive system.